Today's topic, how to practically address incivility and bullying in the nursing profession using two scenarios that I've developed. Scenario number one, you are the new nurse on a med-surg unit. You are the new nurse on a med-surg unit and you admit an elderly woman with a bowel obstruction. The physician orders an NG tube to low intermittent suction. You have never placed an NG tube on a real person, only the mannequin in the skills lab. When you ask another nurse for help and clarify how to properly insert, the nurse rolls her eyes and says, "Look it up in the procedure manual. That will tell you how step by step." But when you approach another nurse who is sitting at the nurse's station surfing the web to also help you insert the NG tube, she huffs and seems annoyed at your request for help. But she does come to assist you with tube placement. When you enter the patient's room, the nurse who reluctantly came to help you says to the patient, "Your nurse has never inserted an NG tube before. I'm here to make sure she does it right." May sound unbelievable, but that has happened, and I have observed that in practice. So let's use the principles of cognitive rehearsal. Number one, pause and process what just happened in this encounter. Well, obviously the nurse is unwilling to help and even mentor a nurse who desperately needs it and could benefit from her experience. When asked to help, she does so reluctantly, is not a team player, and she makes a demeaning comment in front of the patient. So what specifically were the behaviors that were uncivil in this encounter? Well, the literature would call these behaviors, number one, nonverbal innuendo. Whenever a nurse rolls her eyes, that nonverbal behavior is communicating something, and you know what it is. Secondly, when you look at this behavior, it's undermining activities because she's unwilling to offer guidance when needed. And third, it's an example of a verbal affront. This is when you make a comment that is clearly derogatory, demeaning, and disrespectful to the nurse in front of her patient. Well, number three, step three in cognitive rehearsal, how should the nurse respond? Does the nurse let this go? No. The nurse must address this. And so when we look at a prepared response, if you encounter the eye roll, let's look at this first, because we have three uncivil behaviors that the nurse must call out. When the eyes are rolled, the nurse must simply state this. Privately to the nurse, "It appears, by the way, you responded to my request for help, that you have something you would like to say to me. Please communicate directly with me." And you're sending a message that was not okay. Secondly, the nurse who is unwilling to help and offer practical guidance when needed. The nurse would say this as a prepared response. "I would not have asked for help unless I really needed it. Things go much better for both the patients and each other when we work together. I will gladly return the favor when you need it." Very concise and to the point. Third, uncivil behavior, when that comment of demeaning and disrespectful, saying she doesn't really know what she's doing, "I'm here to help," the nurse needs to state in private to this nurse, "I felt devalued and disrespected by what you shared openly in front of my patient. If you have a concern about my abilities as a nurse, please share those concerns with me directly and in private, not in front of my patient." So as you can see, what could be a very uncomfortable thing to do, when you use cognitive rehearsal with a prepared response, you can directly and respectfully address it. Let's go to our second and final scenario. A physician phone call in the middle of the night. This is every new nurse's worst nightmare, especially when you need to contact a physician for a concern, and this physician is well known to become angry and even verbally abusive towards nurses when he's called in the middle of the night. As you communicate your concern to this physician using SBAR, the physician states in a harsh and angry tone of voice, Why did you feel you had to address this in the middle of the night? This could have waited until morning. How do you respond to that? Let's use cognitive rehearsal. And first, let's pause and process what just happened. This nurse was treated disrespectfully and demeaned by this physician response. That's not okay, and you can't let that go. Secondly, what was uncivil? Clearly the harsh and angry tone of voice when you had a legitimate concern. Third, how should the nurse respond using cognitive rehearsal? This is where it gets a little dicey because this is a physician, but physicians do not get a free pass because they're a surgeon or a doctor. You as a nurse are a valued member of the healthcare team, and you must stand up for yourself in this encounter if possible. And this is what you'd want to say. Knowing that this physician has a pattern, you would call it out, and you must do it before you hang up, as difficult as it might be. So for example, you could state this: I called because I had a concern. Your tone of voice is needlessly harsh, and I don't deserve to be treated like that. And the physician may grumble, moan, and then click. It doesn't matter. You respectfully and directly address that uncivil, inappropriate behavior by a physician, and you don't have to take it. And you stood up. I'd like you to know that if you're a nurse educator, I've created a resource called Incivility Essentials that gives new nurses and students practice of this skill using not just 2 that I've highlighted here, but 4 scenarios. And I'd like you to know I also have a PowerPoint to help you explain and define incivility and bullying within the nursing profession. I also have this information in my new student textbook, Think Like a Nurse, Practical Preparation for Professional Practice. And incivility and how to address it must be an important part of your curriculum. In closing, in order for any skill to be transferred to the bedside, it must be repeatedly practiced over and over. Think sterile technique or med administration as a new student. In the same way, cognitive rehearsal is a practical nursing skill that must also be practiced in order for students to be able to use and apply this in practice after they graduate. So make it a priority to provide this needed skill to your nursing students so that they too will be empowered to directly and respectfully address incivility and be part of the needed change that is so desperately needed in nursing today.